me know. And by the way, today going to be very important session, which is dental caries. And I see most of you guys ask for dental caries because you find it a little bit hard. So that's why I'm very happy to simplify dental caries to every one of you. And I know you're very smart. You knew that dental caries is an important topic. And the main reason for this is you're gonna get lots of questions in the exam from dental caries. That's why it's very important. Please, guys, if you see me live on the Facebook, just let me know so we're gonna start straight away. Thank you very much. Let me even put my mic down here. By the way, guys, am I audible? Please, guys, if I'm audible, let me know. Please, guys, let me know because actually I need to know if there is any update happening from Facebook or should every time keep refreshing my window. Seems like I need to refresh my window. Again, that's okay. Okay, guys, for our start, I would love to check on every one of you and say hi, guys. Hi to every one of you guys. If you are on Zoom, you can move to Facebook if you really want to ask me questions. And also, today, very important session because it has dental caries in it. And I believe up to 20% of the exam or 30% of the exam question related to dental caries, either for restorative, either for health promotion, community, operative, endo, x-rays. Wow. Even some of extraction decisions related to dental caries. That's why it's very important. All dentistry based on dental caries, by the way. Okay, guys, for a start, I would love to check on every one of you. Hi, Dr. Jasmine. Hi, Dr. Natalie. Hi, Dr. Shiva. Hi, Dr. Seda. Dr. Kadam. Dr. Jasmine again. Wow, perfect. Thank you, Dr. Nikita. I love to hear this from you. Thank you very much, Dr. Nikita. Guys, Dr. Nikita, guys, saying hello, Dr. Bido, everyone. How was your day, Dr. Do you eat, sleep, and take care of yourself? Honestly, not yet, but I will. Thank you very much for this, Dr. Nikita. I really appreciate it. Hi, Dr. Adam. How you going? Thank you. Hi, Dr. Winnie and everyone. Thank you, Dr. Winnie. Thank you very much, guys. Dr. Rosa and Dr. Amna and Dr. Magda. How you going? Oh, that's a big hi, Dr. Amna. I really like it. Hi, Dr. Magda. Hello, Dr. Adam. And hello, everyone. Beautiful dentist. You amazing, Dr. Magda. Hi, Dr. Matt, Dr. Tanzin, Dr. Deepika, and Dr. Prey. Okay, guys. Now, ready, guys, to start with dental caries? I'm trying, guys, to start as early as I can because we need to finish as much as we can right now. I waited enough for the candidates to be around here. I think that is enough. Okay, let me check if there is any. Dr. Ann, how are you going? I see Dr. Ann there as well, which is perfect. Okay, guys, let's start. By the way, guys, before I start, I cannot forget to congratulate every time. You know what? Tell you something. A week before the result, I believe everyone in the academy, including Dr. Ann, Dr. Lane, everyone, and the candidates, we couldn't sleep. Everyone was worried about the candidates, about the result. And that's why every time I remember the result, I feel very happy. This time, as I always saying, batch 121, batch 111 are the best batches ever. Yes, there are other batches, great batches, but I believe 121 and 111, the best batches ever. Because both of them, we believe that we got up to 90% pass rate. And we are having a perfect, beautiful patch right now, which is patch 123. Very promising. Very promising. And I wish that every one of them pass the exam, and instead of 9 to be 95%. By the way, guys, ADC mostly, they don't make people pass about maybe max 50, 40% max they can pass the exam. It means most of the candidates have passed the exam from us, from our champions. Now, today, we're gonna, guys, be with you always. Today, tomorrow, after tomorrow, as we always do. On our Facebook, by the way, guys, very, very important. Please, guys, very, very important. This group, let me share the group. Give me 1 second, please, guys. I will share the group right now with you. Where is my, here? Okay. Get the group, home. And then this is the group, actually home. And this is the group. Okay. Please, guys, can you see the group right now? This group, guys, is the first group ever for ADC exam. This group is the first group ever for ADC exam. And then after that, there were a little bit like more groups. Now, what we do is, since long time, we help the candidates here. Right? As you see right now, we help you guys. You see, like for this question, there's almost 4,000 people have seen the question. They learned something about the question. Now, these 4,000 people, we're going to delete most of them. Why? Because they have seen the questions. They knew the right answer, but they haven't participated with anything. Look at the perfect Dr. Viba, for example. She explained why B Bravo is the right answer, for example. And that's why Dr. Viba need to comment in this post. Right, guys? Because as I mentioned right now, if you're not going to comment in this post, you're going to be deleted. Right, guys? We already started to delete candidates. So please ensure, if you want to take our help, even if you are our candidates or not, because that's a public, that's not paid, you need to comment in this post. Otherwise, by tomorrow, you will find yourself being deleted, because we're gonna remove whatever not active. Okay? I hope that's clear right now. Back again. For all our champions, you know how much we appreciate you. This is what we're going to discuss today. I'm going, guys, to show you what we're going to discuss today. We're going to discuss about Icdas, dental caries. Perfect. Make it easy to you. You will love it. You will not stuck. I give you some points, some hints. I will be giving you some points and some hints. If you just keep them in your mind, you will not never ever stuck with Icdas anymore. I simplify it to you. And if you're gonna forget one single word from here, most properly, this is going to be an exam questions, and then you may end up with not feeling good. Apart from this, I made another slide to you. Perfect. Why? Because normally, guys, what I do is I keep my stuff as a cluster wise. So now I made another slide, which is careers management. The first one was information gathering. This one and the first slides was actually about careers part for information gathering cluster and diagnosis management, but this one is for the treatment planning. How you can end up with nice treatment planning. Guys, how does it sound to you? Look, personally, I'm very excited. Very excited. I love what I'm doing. I love helping you guys. I'm now checking on the Facebook. So guys, from now what you need to do is pen and paper. I need you guys to get pen and paper right now in your hands. And the things you need for the exam questions, I'm going to explain them very easy to you. And once you write down what we do, any question you get an exam related to the subject or this topic, you will find it very easy. Okay, guys? Guys, do you have any echo? I hope there is no any echo. Now, let me first, guys, because today consider the first day of the course. So I want to do something as well right now. What I want to do is, I want to guys show you the plan I made for you and how we're gonna go through the plan. That's only guys gonna take only 2 minutes, maybe max. Okay, guys, this is the plan we made for you. It's a daily plan for the next. Guys, please guys tell me about your opinion. TG will be discussed multiple times in the course. Multiple times, not just only once, multiple times. This is the first time we're gonna discuss TG with you. That's why we call this TG part, we call it as warming up stage for TG. It's a warming up stage for TG itself. We divided TG into 3 main tasks. First task, second task, and the third task. The first task will be from page 1 to page 115. And it will be for 7 days. Is that, guys, clear so far? Guys, is that, guys, clear, guys, for the week, which is starting the first day, which is starting, I would say, from tomorrow, let's say today or tomorrow, right? We guys going to have 7 days. And by the way, we have updated the TG page number, guys. Now we follow only the new TG, right? Not the old one. Now, first day, we're going to go with principles of diagnosis and management in dental practice. And these are the things you need to go through. Here, we only mention chapter 1 from Dr. Paul Abbott book, from Dr. Cameron. For example, Dr. Paul Abbott will give you just a few chapters. Second day, that will be the plan. Third day, first day, 7 days, day 7 will be revision stage, revision day. Is that, guys, clear to you? Yes, it's TGU4. Yes. If you scroll down Dr. Deepika, you will find it has pages. And we made pages for you guys. You can ask on Telegram group, right? And then you can find the page there. I'm very excited, guys, for this. Things will be very easy. Now, did I do this only for you? Not really. By the way, guys, every one of you should have got, right, guys, every one of you, you should have got the plan. Now, then I made notes for you. You know these notes? Very simple, very easy. Believe me, every single word here is exam question. Every single word is exam question. By the way, I made it cluster wise because some people couldn't pass professionalism or health promotion cluster. Some people couldn't pass clinical treatment evaluation. So I made it easy for you. Guys, this thing does new things. These things haven't been there before. Right? And then pharmacology. For example, by the way, I still have one folder for pharmacology, has every single part in pharma you need to know. And by the way, it is updated based on the new TG. So you don't need to go through TG word by word. You don't need. I don't need to explain things to you like this. But I give you this in better way. For example, I'm asking you what you need to focus on in TG. And then look at this. Penicillin, broad spectrum. In exam, they ask you which type of it is. For example, antibiotics. Most aerobic infection, it's for aerobic. Drug of choice of patient on warfarin. If someone has warfarin. What, why guys, I only choosing these two parts? Why? Why only apart from talking about too much about penicillin, I only give you only this two information about it because I know these are the two things you must know for the exam purpose. Penicillin and clavulanic acid, broad spectrum. Look, in exam, easy, you can get question, ask you about this. What is the broad spectrum antibiotic? I remember Dr. Adam has made file for me. And in the file, it mentioned the broad spectrum is penicillin clavulanic acid, metronidazole, anaerobic, for which cases you gotta get question. Patient has necrotizing gingivitis. What should you gonna give them? Metronidazole. That's it. When should I prescribe penicillin metronidazole? It is broad, exactly like this. And one of the broadest, like if you have clavulanic acid. And this one, which one's broadest? This one. In which cases, severe odontogenic infection when treatment is delayed. Guys, check TG, check our regulations. Now they're gonna give you a case, tell you patient has severe dental infection, and then you delay the treatment. What do you need to prescribe? Metronidazole, or penicillin metronidazole, or cephalosporin, or clindamycin. I remember Dr. Adam made a file for me and was mentioned penicillin metronidazole. Perfect. Clindamycin. When you have, right? When you have severe penicillin allergies. Cephalosporin, mild penicillin allergies. You know what? You don't need to read any more antibiotics. Imagine. Think about it, guys. Believe me, this will be enough for antibiotic. Dr. Nekta says TG people should learn from here how to convey information in simple terms. I love this. Thank you very much, Dr. Nikita. Guys, dentistry for me is love. I love it. That's why I really invent things in it. Okay? So guys, you will find even for this one, nail seeds, where about again first trimester, it going to happen in miscarriage risk. Look at this, guys. I made very nice, beautiful things to you. Look at this. If possible, avoid NAC throughout pregnancy. Don't use NAC in pregnant women, pain 32, whatever. Right? If possible, guys, avoid it. Sometimes you can. Why? Because can happen. Okay, if the patient has gastrointestinal toxicity management, what you need to do? Do this stuff. You get a question about it. Paracetamol. Look, guys. Easy. Love it. That's the guys you got right now in your folder. Make things. This is look. Any notes I made, that's your first choice. Okay, guys. First choice is the notes I make, and then definitely I upload my recordings. Okay, guys. This is my recordings. My explanation about the things. You can go through it and whatever, guys, and whatever I actually teach you, I recorded, I give it to you. Because from last batch, we'll start to give recordings in everything we do. Now, what else I need to share with you? Definitely the mock. I will give you a mock exam like this one and already uploaded to cover the parts we discussed. If this is everything, no. This is not everything, just we started. Right? The study plans, as I show it to you, my cakes. It has, guys, exam clusters. If you have any issue with clusters, like cake information for information gathering, for diagnosis, for treatment, cakes, guys, has the best information ever you can get. Antibiotics cake, you see, that wasn't everything. This is have antibiotics cakes as well. Okay, guys, you can go through it as well. Different things. Then, dental caries, because that was discussed today. Okay, guys, everything you will find it here. For dental caries, for this one, everything. Then, the mock exam and my recordings. The mock exam, the mock answer, and my recordings. I hope now this guy is clear to everyone. Let's now start the beautiful session. Pen and paper, let's enjoy. Guys, don't stress yourself up. There is no reason to stress yourself up. Things really very easy. Things really you can make it very easy. We all here, guys, we all inside this heart. Can see, guys, this heart? We all together can do this big heart. For everyone couldn't pass before everyone has passed. Believe me, the candidate they passed this time, they couldn't pass before. As well for some stages, but now they passed. Don't give up. With guys, with these hands, all together, we'll help each others. We are the biggest family, and we need you. Without you guys, there won't be success. Without you, no success. Okay, let's start. And congratulations again for our champions. Now, Icdas, if you look in the first time, it's really complicated. Tell you something? Sorry, guys, I need to do this again. Really, Icdas, when you look at the article themselves, like when I here right now, and then I share the screen again, and you look at Icdas article, which most probably will be here, you will find it really very hard. Icdas should be somewhere here, like will be, not this one, not in the cake. Icdas article will be in articles. There's 84 pages. Too many, too much. You only listen to this lecture, and then you will find everything easy to you. You don't need to go through this 84 pages and so on. But if you have any issue, you can just have a look at it. Now, back again to our beautiful lecture. So I see that it's on a little bit hectic, but let's start. To make it easy to you, please, guys, every one of you, close your eyes. Please, guys, every one of you, close your eyes. Say yes, I closed my eyes. Why is video getting stuck? I don't think it's stuck. It's fine now. Guys, please, guys, close your eyes. Yes, thank you, Dr. Nicholson. I'm very happy with this. Now, guys, why I'm saying close your eyes? The best way I found it to answer correctly in exam, sometimes you cannot reach the right answer. And to reach the right answer, you should close your eyes for a second and then imagine you are in the practice right now and there is a patient next to you. That's the best way. And that's exactly what we're going to do right now. Close your eyes for a second and try to imagine you are in beautiful dental clinic and you have a patient of dental caries, a patient mainly today for dental caries, nothing else, not for periodontitis, just only dental caries. And then ask yourself some questions. What exactly I need to do for this patient? The first thing that comes in your head when you close your eyes, I need to gather information from this patient. Because without gathering information, I will not be able really to tell what sort of risk this patient. So guys, write down this for us. One, we need to gather information. Why? Easy to determine the risk of the patient. Okay, let's write down this. Please, guys, don't mind my handwriting because I use my fingertip. So, one, we gather information. Why? To determine, look the word here, guys. Let's now use the first things. Determine. That's one. To determine, what we need to determine the risk of caries or caries risks. Easy now, guys? So now in Icdas, the first point in Icdas is to determine. How to determine? We need to gather information. And now they mention here as well, it should be patient level caries risk. Look, this is very hard to understand it, so I made it easy for you. Look at this. This hard. Make it easy. I'm in the clinic. I have a patient for caries. Why should I do this? Because what should I do for this patient? I need to determine. Determine what? I need to determine the caries risk. How can I do this? By gathering information, which is history. Is this point, guys, clear so far? Guys, if one person say clear, I keep going. If no one says clear, I will be stop until, okay, yes, doctor, I'm very happy. Thank you, Dr. Zoa. Now, number one, you gather information to determine the risk. And then after this, what you need to do? I need to determine or detect the staging and the activity. Now, I look at it and then I gather information. Now I need to check if this carries which stage. Stage, guys, mean because the staging is going to help me to determine the risk. Staging will help me to determine the risk. The same things. We're looking now for the risk. And the activity. Is it active lesion or not active lesion? So now, guys, two things will help me to determine the risk. Let's get this one right now. One, we gather information. Why we gather information? Because we need to know the risk. So how we can get into the risk part before we reach the risk? We need to detect what? The staging. Depends on the staging, it will help me with the risk. And what else? Activity of the caries. If there is active or non-active, arrested or still active. Am I, guys, clear in this point again? All this part we can discuss about them in details, but I need you to understand from now the roadmap. If one person said yes, thank you, Dr. Shiva. Dr. Shiva said yes. Now, decide. Right? Decide. Decide on what? Decide on the treatment, or let's say management. Decide on the management. After decide on the management, we think about treatment. D, treatment. Do what? Treatment. So now, I will teach you here right now, not just only caries. I'm teaching you right now I'm teaching you the ADC exam principles. How is this? In exam, you're gonna get questions related to what we call it as management cluster or diagnose and management cluster. When you decide you didn't do any treatment yet by your hand, do, the word do. So when you just decide means management. Why? The candidates always, they telling me, doctor, I fail. Treatment planning and evaluation cluster. I want to study whatever information related to treatment planning and evaluation. How can I differentiate between management and treatment? Management cluster and treatment cluster. Management cluster is to decide. You plan. Let me put these two words easy to you. Management cluster, anything you're gonna do in dental part when you put in plans or you decide, but you haven't done anything. The word do, not here. Do by what? For example, if I'm doing extraction, look at this, guys. If I'm doing extraction, means I did. What does it mean? Treatment. If I plan to treat the patient, if I plan for extraction, is that management or treatment right now? Management. So guys, from here you can learn even one new concept. If you are a candidate, couldn't pass, because I got this from many candidates. They ask me questions like this. Doctor, I failed treatment planning and evaluation cluster. Or doctor, I failed or couldn't pass management, diagnosis and management cluster. I need to study things related to them. How can I differentiate this? So again, management means you plan, you decide. You haven't done things by your hand. But treatment means you did something. Now, if you did rubber dam, if you placed rubber dam, you did it by your hand. Is that management or treatment? You please guys tell me. If you did rubber dam, if the question is, should you do rubber dam or not? Or you are going to do rubber, like you did rubber dam. Is that what? That will be treatment, right? This guys will be treatment, right? Okay, if you did by your hand, treatment. Okay, if you plan, okay, guys. So I hope now things clear to you. Guys, for everyone on Zoom, if you want to really see my comments or your comments, please, guys, come on. Thank you. You're very smart. Thank you, Dr. Ibrahim and Dr. Nidani and everyone, guys. Also say that. Yes, it's treatment. Now, they said this stuff, which is information gathering, detection, decide, do, this 4D. Let's now simplify things a little bit more. You are now in dental clinic. You close your eyes. You start now. The first thing is determine the interview. I'm interviewing the patient this way. And I try to ask the patient some questions. The first things, before even you place the patient dental chair, you will ask about chief complaint. The first things ever. The most important thing for ADC exam, either part 1 or part 2, to determine the chief complaint. This is the most important thing ever for ADC exam, because without determination of chief complaint, you're going to answer the question wrong. Now, what sort of history you need to take? Dental history, like hygiene, behavior, medical history. Most properly, what are the most important cases for ADC exam? Asthmatic patient. And why? Because in Australia we have out of 5 patients, at least 1 asthmatic. Imagine that what I found. So asthmatic patient on cortisone, corticosteroids, hypersalivation. Guys, when I say this, and then if you really want to pass the exam, say this. Look, if I were in your situation, I will do this. Okay? I will say, caries, medical conditions. Dr. Adam mentioned asthmatic. Dr. Adam mentioned patients on corticosteroid. Dr. Adam mentioned patient on radiotherapy. Why? Because most probably these are the cases, these are the risk factor will be combined in dental caries case in your exam. Guys, learn something about me. My brain walks only toward the ADC exam. Like, I'm not going to say anything if it's not a part, right? If not important part that you must know about the exam. Okay, medical history, family, very important. Family. Socioeconomic, more important than family. Why socioeconomic more important than family? Because most probably you will find people, right, which is in rural area, living in rural areas. These people, they have always problems with fluoride issues. And then also, for example, like Aboriginal people, socioeconomic, you may get something related to this as well. Habits and diet. Diet like what? Sugary food, sweet, eating sweets. Okay, so this is the first step I need to do. I need to gather information related to this part. Done. In interview, I did this part. What else? Okay, this classification or this approach, you will not find it easy in any of the books, guys, or any of the guidelines. This approach. This is my approach. Now, doctor, I really need to determine, I'm seeing information gathering. I need really to determine the risk of the patient. How can I determine this? I divided the information or the important information that you must collect. These are the important information you must collect and must know to be able to decide on the Icdas or the management or the carries risk carries risk portfolio. Red, I divide them into red colors and then orange colors factors and the green factors. Why? Because later on you will find that one only risk factor from this two risk factor is gonna take the patient straight away to be high case risk. But any of combination of these two risk factors, it can take you to high case risk. The green factor, they are the protective factors, the things we like it. Guys, did you get the idea so far, guys, how I did the stuff? Guys, did you get how did I simplify things to you? Okay, so now guys, you don't need to know all the factors in the same power. I made the factors depends on which one's more risky than the others. Okay, rate factors, we have hyposalivation and recent caries experience. What does it mean? If the patient has only hyposalivation, it's right away his high caries risk patient. Straight away. You don't need even to think about anything. Don't even think about anything else. Okay. Now, if the patient has recent cares experience, for example, one cares risk experience, straight away, high cares risk, without even thinking about any other risk factors. A combination of one or two of these orange factors will be high cares risk. Green, we love it, but if there is missing green, two of them, for example, patient not taking fluoride, you cannot say his high caries risk straight away. Patient with regular checkup and regular checkup, you cannot say he is high caries. But if this is missing, these two missing, two of them missing will be high caries risk. Okay, guys, let's simplify this one again. Okay, now one. Can you tell me how can I decide if the patient has high caries risk or not? How can I decide? High caries risk patient. It can be any one of these. One, the first one, has only one rate factor, one single, at least one single rate factor, like hyposalivation and or recent caries, high case risk. 2, one or two combination of the orange factors. For example, patient has poor cooperation, and then patient has high sugar intake. In this case, that will be high case risk. If he's missing two of the green factors, for example, doesn't use fluoride, plus he doesn't do regular checkup, we can consider them as high carriers. But the most important for us is the risk factors. Is that clear, guys, to you? Because we're going to get cases, we're going to discuss cases right now, and the case will ask. Okay. Bido math. That's the guy's Bido math. You always, from time to time, you'll find my name is Bido, and math means mathematics. Make things easy to you. If there is a presence of green factors, low risk, like if the patient brushes the teeth, the patient uses fluoride, like this one. If there is existing, not missing, patient brushes the teeth, patient goes for regular checkup, patient uses systemic use fluoridated water, right? In this case, low risk. If there is two missing, not be good, okay? One risk factor, high risk. Combination of orange factor or absent or plus absence of green factor, high risk. Guys, please take screenshot of this and keep it with you. Now, detect and assess. I already did the first D, which is determine. By what we discussed right now, we determined. Now let's detect. What we're going to detect, staging and activity. Now, we said we are now in dental clinic. All this information, do you think, guys, this information, do you really need to open the patient mouth? This guy's part, do you think really you need to open the patient mouth? No, you only need this part. Introduction. This is going to be an meeting, right? Just a meeting. You talk to each others. That's it, right? You haven't yet asked the patient to have a dental chair and then to open the mouth. So determine is just an interview, like a meeting. But, like all the stuff meeting, but from detect, now I need to detect what? I need to detect the staging and the activity of the cares itself. Do you think this can be done by interview? No. Now I will ask the patient, right? Please have a dental chair and open your mouth for me. Remember this. So the second part, which is detect, this will be happening on dental chair. Patient will open the mouth. Okay? Now, you open the patient mouth, and then you found there is a small dental caries on a tooth like this. Now you think about it. Oh, in D, which is detect, I need to detect two things. I need to detect and assess the staging and the activity. Looking at this, can I determine staging and activity? Yes. So how to determine staging and activity? Most probably by vision. Am I guys clear about this point? How can I determine staging and activity? Most probably we start with vision. After this, we may take an X-ray. So now, guys, looking at this right now, you open the patient mouth. His name is Michael. You ask Michael, Michael, please open your mouth for me right now. Michael has opened his mouth. You looking at his teeth. You found this dental caries. Now I need to detect. So the staging, which stage it is? We're gonna teach you this one. Staging, guys, we're gonna discuss with you the staging. Visual inspection first. Okay? I'm gonna make it very easy for you. This guy is very easy to know it. You don't need to be worried at all. Okay? Now, staging. You have looked at this patient. Which stage, guys, do you think? You see, there is, if you look down there, you will find that discoloration has happened below the enamel, like this one, but no cavitation yet. You will find there is no breakdown, but only change in visual change in enamel, but there is no breakdown. So which stage is this? Now, you decide there is really breaking down enamel or not. For example, then like this one, there is any breaking down of enamel on this one? No, it's only changing color. So which stage? Stage 2. Look at this. Stage 2, distinct visual change in enamel. No enamel breaking down. Enamel, no breaking down. No dent exposure. Now is stage 2. Is it active or not? Guys, is it active or not? You know what? Look at the color. To check the activity, right? We need to look at the color, right? And then we need to look at if there is plaque or not. And we need to check with the probe. Is it soft or hard? So now, it was actually the caries was black and was shiny. That's why. And it's away from the gum and no plaque covered. That's why, if you look at this tooth right now, you will find it stage 2 inactive lesion. You're gonna get similar photo in exam and they will ask you about this. Which stage? Is it active or inactive? How did you know? What is your treatment? Is that guys clear so far, guys? We're going to discuss all of this in details right now. Now, the risk factors on clinical assessment. We said this, high risk factors. Look at the patient mouth. You looked at the teeth. You're gonna look at the tissues, right? Look at saliva. If there is low saliva, straight away, as we mentioned, one red, high caries risk. So now look at the saliva. You ask Mr. Michael, open your mouth. Michael, open his mouth. Check the teeth and check the tissues, including saliva. So now we check the saliva, low salivation, high caries, straight away. Okay. Caries history. Look if there is any recent caries experience. If there is any recent caries experience or active caries lesion, high caries risk. Pulp involvement, root caries, sepsis, untreated. If you need to look at this stuff, you need to look at the pulp involvement, root caries, or any sepsis, like there is any infection. So why exactly we doing this? Why did I ask the patient to open his mouth? Why? Because I need to distinguish caries from other factors, other defects. Other defects like what? Can you please guys give me an example? What could be the other defects? Yes, Dr. Aryan, I'm doing again right now because this stuff I like keep repeating again and again. So I will discuss this again right now. Guys, can you please guys tell me what are the other defects can be? Erosion? Maybe. But there is more bit like more things. Fluorosis? I'm happy. I love this. Fluorosis. What else? Easy, guys. Hypomineralization and hypoplasia lesions. Hypomineralization lesions, and you're gonna get questions in exam like this. They give you photo and ask you, is it hypomineralization? Is it hypoplasia? Is it dental caries? Is it incipient? So that's why we do this stage, which is determined to know to differentiate between this lesion and each other. So if you're going to get question exam, we'll be able to differentiate. Identify stage. Is it initial, moderate, or extensive? And then the activity, active or inactive. And then past the caries, fillings, extraction, and sepsis. Guys, is that guys clear, guys, what we do in this stage? These are the things we need to do. Now, we do it by two ways. Visually, once a patient opens his mouth, we say, this patient seems like a high carriage risk patient. Let's now take an x-ray. So one, visually. Second, x-ray. Visually, you look at the facial surfaces like this and the occlusal surface like this, visually. But doctor, the tooth actually has interproximal parts in it. It's sometimes too hard to see visually. That's why you should take an x-ray. So the good thing about x-ray will show you, right, the interproximal lesions, and also it's going to show you the occlusal if it's deep enough, because not every occlusal lesion can be shown x-ray. Only occlusal lesion can be shown x-ray. When, guys? When do you think? When exactly occlusal lesion can be shown x-ray? When exactly? When the caries is big enough or deep enough to reach dentin. If caries doesn't reach dentin, like here and there, like C1 and C2, or from occlusal, the X-ray will have something called superimposition. The enamel will be superimposed in the X-ray, and then it will not show you the caries. But when exactly the caries will be showing, as you see, right? When it goes in dentin, because dentin doesn't have that much superimposition, like in C3. I hope now things is clear so far. Now, doctor, I'm looking at the patient teeth. I need to know only by looking which stage it is, which code it is. So we divide them into three stages, or actually four stages. The green, which is sound tooth. Yellow is initial caries. And pink is moderate or established caries. Red is advanced or severe caries. So guys, how many stages, guys, they are? How many, guys, stages? Okay, sound tooth, forget about it. Let's start with yellow, pink, and red. Yellow, pink, and red. Three stages. Yellow, initial caries. Pink, moderate or established. Advanced. Why? Because in exam they give you this photo and they ask you, is that incipient, like initial, or is that moderate, like established or non-established, or advanced or extensive? Doctor, I will forget about them. No, you don't need to forget about them. You know why? I will teach you now one technique you will never forget about them. Okay. There are three things. If you keep them in your mind, right, you will be able to determine any stage in this life. Three, actually four things. Three, but there is one which is written one of them. Now, what they are. Guys, please, guys, tell me, guys, what they are. These are three important things that can make you determine is it initial caries or moderate or advanced. Tell you something, when you look at the photo like this, You know what I look at? Any photo, like this one. I will look at one, the color. Any change of the color or not? Two, yes, there's a change. Two, enamel breakage. Enamel breakage is enamel damage. Enamel has been damaged or not? Like cavitation. Enamel damage or cavitation. Three, undermine the enamel. What's wrong with undermine the enamel? Is that just a shadow? Right? Or I can see the enamel undermine. Four, which is related to cavitation. How big is the cavity? The extension of cavity. Okay, let's guys take them in order again. And please guys, let me know if you really got them right or not. They are four factors. I need to look at the tooth. One, guys, again, guys, sorry guys. You will not find this in Icdas. The people themselves, they have done Icdas. They actually didn't do it this way. They didn't even explain it this way. Okay, guys? So if you're gonna miss this information right now, good luck. But if you're gonna write it down, really good luck. One, what you need to do is you need to look at if there is discoloration on the tooth or not. Change in the color. Let's say changing color and the anatomy, like deep grooves. Two, you check for undermine the enamel. What does it mean undermine the enamel? No cavitation yet, no cavitation. Just undermine, and then you will find the shadow, or right refined shadow, most refined shadow, or white lesion. Three, enamel damage. Enamel damage. What does it mean? There is cavitation. When you see cavitation, what will happen? You can see the dentin. You see the dentin straight away for extension or the size of the cavity if there is cavitation. Am I guys clear about this so far? If there is only one champion said yes, we are clear, I can keep going. No, Dr. Shelba, texture more important. But let's please go one by one, Dr. Shelba, please, because we are now not in activity. We are now in staging. Let me just finish the staging. I will be very happy to help you with the activity. Okay. Let's now, guys, determine this. Determine based on this. Now, okay, guys. 0 means 0, sound tooth. 1 and 2, initial caries. 3 and 4, pink, moderate, established. 5 and 6, advanced, extensive. Easy now, guys, to keep this in your mind? 1 and 2, just we learning, initial. 3 and 4, we learned, so we established. 5 and 6, now we have extensive experience. As if you play soccer, for example, play bicycle, anything. Easy now, guys? 1 and 2, initial. 3 and 4, established. 5 and 6, extensive. Easy? Now, code 1 and code 2, initial. What is going to happen? Just a change in the color. That's it. Only if you see changing color, only like a little bit of opacities, that's code 1. Code 2, distinct visual, change in enamel. Distinct, what does it mean? Not just white and black. For example, and it's very clear, distinct like very clear. But again, no enamel breaking down, no dent exposure, it's still initial. Code 2. What about code 3? Once you see an enamel has been broken, straight away, code 3, straight away. Don't think. but dentin not visible. What about code 4? Enamel is broken, but there is underlying dark shadow from dentin. Not yet. You cannot see dentin yet. Dentin not visible. Once you see the dentin visible, it's right away you're gonna be 5 or 6. If it's really extensive, will be 6. It's small, will be 5. Now, discoloration only, without enamel breaking down, 1 and 2. Once the enamel start to breaking down, you are now 3 and 4. Once dentin will be exposed, you are now 5 and 6. Guys, how easy is this? I don't think really I should repeat again. What do you think, guys? Should I guys repeat again or easy right now? I'm happy guys to repeat again. So guys, my Facebook doesn't work in here. Every time Facebook teach me something new in this life. Now start to work again. Live again, live. Let me check, guys, if it's fine. Okay, guys, I will repeat this one more time. Now, if just only opacity is changing color, code 1 or code 2. If there is enamel damage, but no visible dentin. Now we are on code 3 and 4. Now, if there is dentin exposure, you are now in code 5 and 6, which is extensive. Okay, guys, I hope that's clear right now. Let's move on. What about the root? If there is no color change or no damage, it's sound. Initial, you have surface loss, it's just like 0.5 millimeter, no cavity. Moderate, it's from 0.5 to 2 millimeter. Extensive, it's 2 millimeter. Guys, am I guys audible to everyone? Because I don't know why my page doesn't want to work. Okay? That's the root right now. Now it's very important. Doctor, how can I decide if it's active or non-active? Now, how can I decide? Is it active or non-active? Here is very important. When exactly you can decide if the carrier is active or not? 1. Initial or moderate. And active. You will find enamel white or yellow. Dull and rough. Which one more important? The color or texture? Texture. How can I check the texture? By plant probe. Not an explorer. Not sharp explorer. By plant probe, okay? Okay. And then you will find there is a plaque areas. There's pit and fissures, right? There's a plaque. You will find there's plaque around it. Maybe even covered with thick plaque. Extensive, you will find dentin soft or leathery to probe. Leathery. What about inactive? If it's initial moderate, like there is no breakdown or just a small breakdown, but dentin not exposed, in this case you will find enamel is white, brown, black, but mostly black, dark in color, shiny, hard, and smooth. How can I notice hard and smooth? Again, by texture. By what? Plant periodontal probe. Plant probe, sometimes periodontal probe. And then away from the gums, away from the plaque. Extensive, you will find dentin shiny and hard to probe. The dentin will be shine and very hard, not soft like here. Is it guys clear, guys, to everyone? Now we know. Let's have a conclusion about all of this together. Let's guys conclude all of this together. Bido math, make it easy. Ask yourself a question. Any red risk factors? Like two risk factors, new caries and hyposalivation. Any of this? Yes. Means what? High risk. No, patient doesn't have actually any saliva issue. Patient doesn't have any new caries. No, I haven't seen any. Okay, now you go check this. Other risk factors combined high. Yes, there is two orange factors combined. Now it's high. No, he's actually perfect. No even orange factors. Now, protective factors. There is any, does he have like fluoride and the fluoride topical and fluoride in water and he sees the dentist all the time like regular visit? Yes, he's low risk. No, two of them no, high risk. I hope now guys things is clear. Okay, we finish with this part. How it is? Easy guys? Do you want to have more question about this part? Or do you want to move to the second? Or do you want to guys move to the second part? Or do you want to keep the second part for another session? I'm happy, guys. I'm open with any. Do you want to continue with the second part? Or do you want to have, we can just go through some questions here? I can share some thoughts and you tell me? Or you need to start with the second part? Which one? Is I'm beautiful. I'm very happy to hear this, Dr. Ramin. Move to second part. No one guys got tired? Do a little bit of questions? Let's continue. Okay, guys, I'm happy with this. Okay, let's see now, guys, decide on this. Now, okay. I will, guys, ask you, tell me why. Tell me the reason. Guys, this photo, why it's code 2? This photo, guys, why it's code 2? Give me 3 explanation. Like, for example, guys, by the way, if you have this critical thinking, you will be able to pass the exam. Tell me, for example, 1, it has extensive discoloration. 2, enamel, there is no damage to enamel. 3, there is no exposed dentin or undermined dentin. If you say like this, I will be very happy. Thank you very much. Very smart. Thank you, Dr. Shiva. Thank you, Dr. Tias. Thank you, Dr. Maya. Perfect. Thank you, Dr. Anna, and everyone. Okay, let's, guys, apply the same concept again for this one. Why do you think this is code 4? The first thing you can tell me is enamel is broken down. What is the second thing? Like damage, like there is enamel of damage. You see, guys, damage, 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 damage. Now, can I see dentin? No. Dentin not. Dentin is not showing. Very good. There is undermined enamel, yes, but dentin not showing. Now, let's now ask you a question. Why do you think This is code 5. You know what is the first thing should tell me? Only one thing. Dentin is showing. Means there is cavity, then showing. And then small cavity, not very big. But dentin is showing. Now, I may ask you another question. Tell me, why do you think this active? Active lesion? Because dentin is in yellow color. Yellow and seems like more into soft, fragile. When you look at it, it's matte, not smooth, matte. Like this one as well, like chunk, matte in color. Guys, I think that's clear by now, right? Let's move to the second slides. Let's, guys, move the second slides. Ready, guys? Ready? Who's guys a bunny? Any one of you guys bunny? Do you know, guys, do you want to be bunny or turtle? Which one? Do you like, guys, to be bunny or turtle? Do you know, guys, I want to be turtle? Know this about me, because I'm like, in my life, I'm like a bunny. But I want to be turtle, because turtle, guys, has less blood, sorry, less heart rate, like pulse rates, and they can live a longer time because they're slow. When you fast, guys, you die early. So, guys, be a turtle then. Anyway, again, we have learned how to assess, how to detect. Now we need to know how to decide, how to treat. So now we did the information gathering part of Icdas, and we did the diagnosis part of Icdas. How to determine high carriage risk or low carriage risk in simple way. How to determine the code and the stage, and how to determine is it active or inactive. Based on this, we need now to learn how to set up the plan. What sort of plan are we going to do for these lesions? And what sort of treatment? Now, guys, okay, let's start. So we finished the first one, determine patient. We finished detect. Now we on decide and do. Decide and do. Decide. Decide on personalized care plan and do appropriate prevention and preservation intervention. What does it mean? Something seems like very hard. I don't understand this. I agree. Let's now simplify. To make it easy to you, I divided this part into primary teeth and the permanent teeth. What about primary teeth? You see, guys, should be, guys, is this primary or permanent? I think that's permanent teeth, right? Anyway, primary teeth. Now, let's say there is a 4-year-old child present for a dental examination like this one. Based on ICDAS or ICCMS, which is ICDAS criteria, and the attached photo, what is the most likely diagnosed 5-1? 5-1, guys, what do you think? Is it code 102 or 3, 4, or 5, 6? Let's ask yourself. 1. Do I see any cavitation around? If I see cavitation, there is any really exposed dentin? No cavitation, no exposed dentin. We're talking now about code 1 or 2 caries. Easy now, guys? I see every single person of you did the right thing. You know what? It's always my happiest time when I see you guys got the things in easy way and simple way. You see, I see Dr. Natalie said A, Dr. Sepia A, Dr. Maya A, Dr. Ashik A, Dr. Achal A, Dr. Shiva A, everyone, Dr. Natalie, code 102, AA, means you got it right. Perfect. Let's keep going. I'm happy now. Yes, the answer is code 102. Perfect. Let's do the second part. Second question. Based on ICCMS, Icdas criteria, and your diagnosis of elevated carriage risk, what is the best management, guys? We gotta discuss this in details, but I'm giving you this now just to refresh your information knowledge. You know what, guys, the right answer is? I know you may get a little bit of confusion this one, but don't worry, I'm going to explain to you. Now you have this beautiful girl in your clinic, and you find it's code 1 and code 2. So what is the right answer? Apply fluoride vanish every 3 months. I see now the answer change. Some candidates said A, and some candidates say in B, and some people say, why not fluoride? Now we have different answers. Some people say D delta, prescribe 5,000 ppm. You see, because I didn't explain it, you have confusion. Let's explain it right now. I tell you the right answer. The right answer here, guys, is B, bravo. I see, but I'm happy because most of you said B. I know there is confusion. I see D, like, look, guys, if you look now, you find D, and so, but that's okay because I haven't explained it yet. The answer is B, bravo. 5,000. Why? I'm going to explain this in details right now. Now, you will learn the management in the right way. Apply fluoride vanish every 3 months. It's good, not bad. But this is not the best management. The best management is fluoride at home. Recommend 1,000 ppm fluoride. Yes, why? Because her age is 4-year-old. And she is right now, right, high carriage risk. So that's why we need 1,000 ppm, because in normal cases, we actually, guys, in normal cases, how much fluoride she should have? If she's not high carriage risk, she should have half amount, which is 550 ppm. Apply fluoride gel every 6 months. No, it should be every 3 months. Prescribe 5,000 ppm. This is actually for adult, for people, they are adult, not just adult, maybe people like they are maybe 10-year-old and above. And even 6-year-old sometimes in under supervision, sometimes can be. Use fluoride mouth rinse. No, not in 4-year-old. Maybe when they are like 10-year-old. Or sometimes 6 under supervision, but yeah. Now, the answer is B, bravo. Why? Because diagnosis is 1 or 2, initial caries, and treatment we need to do mineralization, remineralization. Now, how can I do mineralization or remineralization? How we can do it? We have, you see, guys, mineralization means strong. What does it mean, remineralization? Make the tooth strong. The tooth now is weak. Demineralization, soft. You need to make it strong. You see, guys, I'm strong. How we can make it strong? By 2 steps. At home, patient like you now, guys, only by myself explain the stuff It's like dental clinic to you. But to study at your home after we finish the class means home care. So to pass ADC exam, you should have home care to study by yourself and dental clinic to attend the classes. So now, to strain the teeth, you need to have home care and dental clinic. Home care. What exactly need to be done at home care? Oral hygiene and fluoride application. Good. Oral hygiene. What's involved in oral hygiene? Dental brush. Which one we recommend? For kids, we like to use the kids' dental brush. Not necessary at this age to get the electrical. They can use a small head dental brush. They can use soft bristles, not hard. Okay? And then floss, very important. Even for baby teeth, yes, because you may get question about this one. The mom, do you may get question? The mom ask you, doctor, he's just a baby. How come we can be flossing? You don't need to floss. No, floss always must be used if there is contact between teeth, regardless is it primary teeth or permanent teeth. If there is a contact between the teeth, you must use floss. Modification for all risk factors. Any risk factor, patient doesn't drink enough water, hypersalivation. In this case, they need to drink enough water. They don't have fluoride at home, like tap water. Guys, learn this. The word tap water has fluoride in it. In exam, if you see this, if you read this word in the scenario, patient drinks tap water, means there's a fluoride in it. Patient drink tank water, no fluoride in it. You must learn the Australian terms. The Australian, I don't know how we can say it. I would say terms. It's not a language because we speak English here. It's just terms, vocabularies. Okay, guys? Is that guys clear now about the water? Clear now, guys, about water? Everything's clear? Should I repeat this part or is it clear? Please, guys, because I don't see really my Facebook. If you can hear me, guys, please tell me you can hear me. I don't know why my Facebook doesn't work still. Sometimes works, sometimes doesn't work. Anyway, I hope that's clear for everyone. Now, what else? Fluoride application. So now, hygiene is the first one, oral hygiene. Second one, fluoride application. What sort of fluoride? At home. I'm talking at home. I'm not talking in the clinic. I'm not explaining about the clinic now. I only tell you at home. Now, at home, toothpaste recommendation. So at home, right, for kids, the most important type of fluoride is water fluoridation and toothpaste. Less than 18 months and patient not at risk. No fluoride concentration. Nothing. You don't need. 18 months, less than 18 months and at risk. Yes, you can use toothpaste. 18 months to 6 years, not at risk, normal kids toothpaste, because it's still a child. 500 to 550 twice daily. He's actually at risk 1000 ppm or the same. That's, guys, let's do this one. Let's say child toothpaste, and this call it adult toothpaste. Guys, toothpaste, I'm going to divide it to you to 3 toothpaste. Let me just get a clean. Yes, wow. That's funny. Okay, guys, you have 1 child toothpaste, 2 adult, call it this way, toothpaste, 3, call it therapeutic therapeutic, toothpaste oil or high concentration, either way works fine. High concentration toothpaste. What does it mean, child toothpaste? It has 500 to 550 ppm fluoride. Adult toothpaste, it has 1000. Therapeutic, 5000. Or high concentration fluoride toothpaste. Guys, am I guys clear about this? So guys, can you guys tell me the adult toothpaste has how much concentration in it? Very good. Now, make it easy to you, more easier. Child toothpaste. And by the way, guys, there is one more toothpaste, 1 second. Infant, let's call it this way. Infant toothpaste. Infant. Okay, guys, let's make it 4. Infant has no fluoride in it. No fluoride. Okay, guys? So now, 1, infant. 2, child. 3, adult. 4, therapeutic. Infant, no fluoride. Child, 500 to 550. Child, 1000, 1K. Adult, therapeutic, that's fair. So infant, normally, less than 18 months. 500, right? That normally until 6-year-old. Adult, 6-year-old, high cares. Or, right, more than 6-year-old. Therapeutic must be more than 6-year-old and hikers. I hope it's clear right now. Okay, guys, please, guys, be careful about the word more frequent because really very important, this part. Now, mouth rinses. For kids, right? If they are more than 6-year-old, must be more than 6-year-old, okay? Under supervision. They can use 200 ppm fluoride, mouth rinse. And this daily. So now, to prescribe fluoridated mouth rinse for a child, the child must be more than 6-year-old and should be under supervision. So what is the options we have right now? Neutral fluoride, sodium, it should be sodium fluoride, but it's fluoride, yes, which is formed in sodium fluoride. Rinse 200 ppm when daily. Or neutral fluoride, rinse 900 ppm when weekly. What else the child can take at home? The child can take CPP ACB cream with or without fluoride, 10% fluoride, 10%, all ages based on TG. Based on the company, the manufacturer, the patient should be more than 3 to 4 years. When twice a day. Now, let's conclude this, guys, to you. Tell me, guys, is it easy or hard so far? Just to conclude things to you. Is it easy or hard? Easy, thank you, Dr. Sepia. Now, if you have a case in the exam and they ask you which one is the most important, is oral hygiene or let's guys play this game, oral hygiene or using CPP, ACP. Which one, guys, is more important? Let's play this game together. In the exam, you have multiple options, and you keep thinking, oh my God, which one is more important? Oral hygiene is important, and the mouth rinse is important, or oral hygiene is important, and also, what else? And also, CPACP, oral hygiene important. Thank you. Now, is oral hygiene important? Look at this. Oral hygiene important, or mouth rinse? Oral hygiene important. Okay, which one more important? Toothpaste? Toothpaste, right? Or mouth rinse? Toothpaste was fluoride, better than mouth rinse. Did you get it? So, however, all of this important, you must have the critical thinking to be able to understand which one has a better or more effect than the others. Now we have done the things at home. Let's now move to dentist. By the way, guys, which one more important? At home practice, if it is done perfectly, or dentist for dental caries, not for periodontitis, not for periodontal diseases. Which one more important? Because you may get question about this. They ask you, you went to church, you went to school, and then the patient you give him some instructions. Which one is more important? To ask the patient to follow on dental hygiene at home, to brush the teeth, or to come and see you every 6 months? Which one more important? You see, guys, critical thinking. That's a way you're gonna pass the exam like the champions. And by the way, I always say, even the champions couldn't pass the exam. Believe me, they're smart, and some of them, they're even more smart than them. The candidate they pass the exam, and they will pass this time. I'm sure about this. So, guys, home care at home, more important. Actually, both of them very important. Don't say I'm not saying the dent's not important, but it is more important than the dentist. Now, at dentist, what we can do? What we can do at dentist is, right? What we can do at dentist is, you can provide fluoride vanish. So now in exam, they ask you, which one more important? Is toothpaste, like 1000 ppm or 5000 ppm, depends on the age and all this stuff, or fluoride vanish toothpaste? More important. That's why home, it's more important than clinic. So now, fluoride vanish, how much? 22,600. How often? If it's just 1 year old, right? So maybe most frequently, more than 1 year. Should be more than 1 year. The patient should be more than 1 year. So in this case, 1 to 2. It can be more if the patient has high caries risk. It can be at every visit if the patient has high caries risk. So normally, as preventive way, guys, keep the things in your mind. We have preventive and we have therapeutic. As preventive way means patient risk is low. Preventive means patient risk is low. Caries risk is low. In this case, 1 2 years. What if it's therapeutic? I need to treat the caries. I need to remineralize it. So fluoride vanish should be done at every visit. Patients sees you sometimes every month, sometimes every 2 months, sometimes every 3 months. Depends. Gel or foam. We don't like foam very much. We prefer gel because foam, kids can't swallow the foam most properly. Gel. 12,300. Patient should be 10 years old. If they give you a question, they are very tricky in the exam. They may give you this option, patient age is only 9. So in this case, 1 to 2 years or every visit, as we mentioned before. neutral gel foam, 5,000 to 9,000 ppm. In this case, again, the same things. It should be the patient more than 10-year-old, and then twice a year or at every visit. Sevofluride for kids, we like it. We like sevofluride as a sort of restoration, which is Rivastar. We got it from we got it in the capsules in the clinic, right? So you can do as a restoration. Fluoride, CPP, ACP, plus Vanish, it can be all the ages. So guys, all the things, it can be applied in dental clinic, but most properly, because this one plus Vanish, most properly, kids cannot use it at home. So now guys, I simplify things to you. I divided the things into home care and dental clinic care. Let's answer this question. This case, what are you going to do? What's the answer here? You know, guys, if you got it was the right answer, I will be very happy. Very happy. Look, guys, carefully here, guys. Something happening here. If everyone can look, we shouldn't forget, right? Look at this. Look at this. We talk about tooth number 62. This guy is 62. Look at this. I'm very happy. I see everyone says P bravo. Dr. Deepika P bravo. Dr. Harini P bravo. Dr. Teas P bravo. Dr. Karan P bravo. Dr. Saunders said code 3 enamel breakdown. Perfect. You see, guys? Tick. B. Happy now, guys? I'm happy that every one of you guys got the concept right today. I'm very happy. Let's now, guys, move to the second slide. Yes, it's B bravo. You're totally right. Code 3 or 4. Why? Why? Enamel is broken down. Easy. Look at this. Enamel is broken down, but dentin not exposed yet. Okay? Seen enamel only. Very good. Now, we have discussed the management, and now it's easy. We mentioned, based on Icdas criteria, you diagnose elevated risk, and she was 4-year-old. It's a baby tooth, seems like. She's baby? Yeah, 5-year-old. What is the management of 6'2"? Do you think, can we remineralize 6'2"? Cavitated. If there is cavitation, don't remineralize. Why? Why am asked this question? You see, guys, you see B bravo here as well. Why? Because most properly we haven't discussed this part. Okay? Because this is the second part. Second part is how to restore the treatment now. Not just the stuff will be treatment. You see, guys, I'm taking you like step. Very short steps, very small steps. Right? So what is the right answer? You say, Dr. Adam, I see there's cavitation there. Remineralization will not happen. So what is BDO math here? BDO math is cavitation equal to remineralization. Can you please guys write down this for me? BDO math, mathematics. Cavitation equal to remineralization. Okay? So means cavitation means no remineralization. Means cavitation means restoration. No cavitation. No cavitation equal to remineralization. Cavitation means no remineralization equal to restoration. Okay? So now, because it's already cavitated, we need to do restoration. Which option here with the restoration? GIC. Doctor, do we really use GIC? Yes, and kids, we love resin modified GIC. The phrase, the gold standard. Guys, the word gold standard. Okay, guys, I like the baby steps. I'm very happy. Dr. Ayushi, how you going? I like your comments, Dr. Ayushi. How we going? There is very nice question here from Dr. Snail. Dr. Snail say, Doctor, look guys at this. Very nice question of Dr. Snail. Dr. Snail says, ask question. When question asks for management, we are deciding, right? And how can the answer be restoration? I tell you now. The word management is a broader word. It does include in it the treatment itself. And that's what you can find in TG. Go and open TG in the first few pages. I already made the plan for it. I already gave you news about this. So the word management, not only what you decide, it's mostly what you decide. But the treatment is a part of management because management is everything, overall management. Okay? Anyway, answer is E echo. Restore with resin modified GIC. Okay, perfect. Let's keep going. Clinical judgment, BIDO math. Let's use BIDO math approach. Number one, you need to diagnose. For example, you diagnose this case as code 3 or code 4. It's cavitated, moderate size, restoration. Baby teeth, GIC or composite. Please, guys, keep this in your mind because in the exam, they will give you teeth and they ask you what sort of cement you should use. What sort of restoration should you use? What sort of crown you should use? So please, guys, in every session, I will teach you one of these on the right time. Based on BIDO math. Now, OI. This case, what do you think the right answer? You know what I love, guys, about you? That you still existing with the same number. You are very attentive. You write down everything. I'm very happy with this. Why we love a resin modified GIC? I tell you why. We love, do you want a book to write down why we love GIC? Okay. Guys, big book. 1. GIC can be used with water and with less isolation. It is water, love. Okay? Composite not. That's why we like it. 2. Easy to use. Very easy. 3. Strong enough, especially in a small size cavities, or a little bit medium size too. 4. Releases fluoride. 5. Conservative. What does it mean? No need to cut too much from tooth structure. Why? Because it does attach chemically. 6. The coefficient of thermal expansion closer to dentin and a little bit closer to enamel. 5, 6, 7. You don't need special instruments. Sometimes it can be no need even for light cure. 8, easy to manipulate. Do you want more? Or that's enough for why we like resin modified? Why we like GIC? I can give you more. Guys, what is the answer, guys, for this one? What is the answer? Dent exposed, there's dent exposed. So now we are between 5 and 6. See, Charlie. Yes, 5 and 6. Now, given that teeth 5-1 and 5-2 are vital, what is the best management? 5-2? Guys, this is 5 quadrant. There's 6 quadrant. There's 7 quadrant. That's 8 quadrant. I don't know why they made it this. They should make it the way around. They should count this as quadrant 1, quadrant 2, quadrant 3, quadrant 4. An adult should be quadrant 5, 6, and 7, 8, because this fair. The child has the first teeth, then the adult. I don't know, but anyway, that's not fair. So what is the right answer? Given that these 5-1, 5-2 are vital, what is the best management? I see answer now between C and D and B. C and D and B and A as well. Because guys, we haven't discussed this topic. I will discuss it in management, in treatment part. Now, do nothing. No, that's not right. Recommend 1000 ppm. No, because this is not remineralization stage. No, that's cavitation. Restore with freehand composite. 5-1 and 5-2 with freehand composite. I doubt it. This is very destructive. Very destructive. Look at how there is nothing left there. There's nothing on tooth structure, especially after you remove the soft dentin. That's all soft dentin. Nothing gonna be left. Restores composite resin strip crown. Good. Crown will strengthen. Restore with zirconia crown. Expensive. Expensive. And more destructive than this. Why? When you have composite resin strip crown, you don't need to prepare a lot. Adjust celluloid like plastic, you fill it up with composite, you put in the tooth. Perfect. Perfect. Conservative. Strand the tooth. 1 conservative. 2 strand the tooth. 3 easy to use. 4 cheap. 5 we only need it for how many years? Patient 5 for another 4 years. Another 4 years what? Another 1-2 years only. Only. Why should I go to zirconia then? What is the right answer? How did I get the right answer? I thought about all the factors together. I need something cheap, like affordable. I need something will be strong enough for 2 years. I want something easy to be done. Doesn't weaken the tooth with more preparation. Less to be done, so D delta is the right answer. Restore West composite resin strip crown. What's the diagnosis? We done Bido math. Diagnosis, code 5, code 6, cavitation, extensive size, then crown. If it was moderate size, I should have chosen GIC, for example, but it's not. Anterior tooth, composite strip crown. Permanent teeth. This guy has nice permanent teeth. Guys, are you guys happy to keep going or should I stop here? If you're tired, I can stop. But you know what? I'm very proud of you guys. You did a very good job today. Dr. Zoha saying keep going. Only Dr. Zoha? Let's see the rest. Keep going, doctor. Thank you, Dr. Thais. You're very nice. Not tired, enjoying? I'm very happy, Dr. Zoha, to hear this from you. You are amazing. Almost midnight here, Dr. Achel. In New Zealand, doctor, I know, doctor. Sorry, doctor. So I should stop for you then, doctor? Happy, doctor. Dr. Rosa say happy? Yes, keep going, please, Dr. Winnie. Okay, guys, we can go a little bit more. Maybe one more slide, two more slides, maybe. It just, guys, very enjoyable, by the way. It's very enjoyable. You don't need to... I just made it in question answers for you, just to understand it better. Look, guys, I'll show you how I did it, guys. Look, very enjoyable. Very easy. Look, what I did is questions, answer, questions, answer, questions, answer. And then very enjoyable, easy now. Bidu math, steps in very easy way. Mostly replication of things what I did before, but in different ways. Look. You will not feel tired. You will not feel tired. I promise, guys. You will not feel tired. Dr. Anum, we would love to say keep going because your teaching style is so addictive. Thank you, Doctor. I really love to hear this from you guys. You're really amazing. We can continue if you didn't tired. Dr. Bidu, you're very nice, Dr. Lev. I really appreciate this. I'm tired, but I can keep going. That's okay. Let's keep going. We can do it. We need this. We need this. We need this power. We need this energy, guys. Okay, now a 19-year-old. Now, guys, we're talking about adult, permanent. We're not talking about kids anymore. Clinical case 4. A 19-year-old patient attends for routine checkup and clean. Based on the attached clinical photo and Icdas visual criteria, visual, what is the most appropriate code? Visual. You may hear guys get a little bit confused, but don't confuse yourself. There is no breakage down of enamel. There is no breakage down. Enamel hasn't been broken down here. It's still like it's a discoloration, which is deep grooves, but not broken down. If enamel not broken down, what do you think, guys? Answer. Wow. Most of you said it, guys. A alpha, right? I'm really very happy with this because enamel in this area is just deep fissure. It's deep, but not broken down. Okay, no breakage. Okay, guys. So the answer right now is 1 and 2. Code 1 and 2, guys. Okay. Yep, 1 and 2. Now, if it's 1 and 2, what you need to do? We said there is a deep fissure. The question: what is the most appropriate next step of management? Apply fissure sealants or place preventive resin restoration? Monitor and review 6 months? Take bite with an X-ray? Or apply topical fluoride varnish? This guy is tricky. Read the questions. Read all the options. Read the questions. Read all the options. Very tricky. Very tricky. Please, guys, I don't think, guys, you attended this class with me when we talk about fissure sealant. Maybe you haven't attended this class with me. You really need to attend the class to understand this question properly. What is the most appropriate next step management? You have this caries, and you have this caries, initial caries. Now what you need to do? The answer, guys, D delta. Take bite wing X-ray. Why? Why we should take bite wing X-ray? Because my treatment should be apply facial sealant. That's my treatment. But learn this. No X-ray. Guys, write down this. No X-ray, no facial sealant. Right, okay? The treatment for this case should be facial sealant. But the question asks about the most appropriate next step. The question asks about the most appropriate is to do facial sealant. But before this, I need to take X-ray. So now the most appropriate next step is take X-ray before the facial sealant. So now no X-ray equal to no facial sealant. Answer, guys, D delta. I know, guys, I believe most of you guys here learned this concept for the first time. So the answer is D delta. Take bite wing X-ray. Yes, Dr. Ayushi, all of them looks right. And this is ADC exam. This is the trick about ADC exam. Then, guys, after X-ray, you do facial sealant. After X-ray, do facial sealant. Why? Because this is not established caries. It's just the initial caries. Initial caries, we do stuff. Okay. Now, a bite wing radiograph showing no caries extending dentin. What is the most appropriate next step in management? Now, guys, what think that the answer here? The bite wing radiograph showing no caries extending. Indenting. You took X-ray. You found no caries. What you should do next? For this caries, look for this one. You took it, guys. Always close your eyes. Always close your eyes and think what could be next step. Answer is apply resin facial sealant. After we take an X-ray, we need to apply facial sealant now. Now we can apply facial sealant. Now we can. So X-ray first, decide and ensure there is no caries, deep caries on dentin. Now put facial sealant. Why? Because if you in the X-ray, if you see there is occlusal caries in X-ray, you cannot place facial sealant. You need to do restoration. Next question. That's the answer, guys. Okay. Now, this is one a little bit tricky. Really tricky. I think really I need to do sessions for X-ray then. I think so. Okay. Based on the bite wing radiograph, tooth number 24. Guys, we're talking about that tooth. 24? Sorry, guys, that should be 34. This guy's left-hand side. Because careful is B, left-hand side, okay? That shouldn't be 24. That should be, sorry, guys, 24, yes. 1, 2, 24. 24, this one. This one, 24. Sorry, guys, after 2 hours. That's why I always tell you, never answer mock exam, never go to your exam when you're tired. When you're tired, you start to do like me right now. I always tell, since 2011, I tell my candidates one thing. Don't trust me after 10 p.m. Sydney time. I always, guys, tell my candidate this way. Since 2011, I always tell them, don't trust me after 10 p.m. Sydney time. Why? Because I feel tired. That's why I want you, when you go to exam, ensure you sleep well. When you do the mock exam, ensure you sleep well. Otherwise, even if you know the information, you will not be able to do it right. So guys, we're talking about this tooth right now. 2-4. What do you think is the answer for 2-4? You see where is the caries? Caries haven't exceeded the enamel thickness. Still in enamel. Caries still in enamel. Is it code 1 or 2? 0? Code 0? Oh. Code 0 means no radiolucency at all. Because guys, if you look here, I'll show you something. This is a radiolucency. Code 0 means no radiolucency, but we have radiolucency. Where about? Is it still in the enamel or crossed the dentine enamel junction? Is in enamel. Is it half enamel or more than half of the enamel? More than half of the enamel. Okay? So now, ask yourself questions. 1. Is it, if the enamel this way, the enamel like this way, look guys, that's the enamel, this part, right? Half of the enamel or more than half of the enamel? More than half the enamel. Half enamel means code 1. More than half enamel, code 2. Crossing the interior enamel junction, but still like in 1/3, 3. More than 1/3 indenting, 4. Close to the pulp, 5. So now is it an enamel? Yes. More than half the enamel? Yes. Did it cross the interior enamel junction? No. No? No? Yes. So now we are talking about code 2. Thank you. The answer is code 2. Next question. Now you know it. This one you know it. What is the most appropriate management? No cavitation yet. Code 2. Initial caries, not even established. Remineralization. Patient 19-year-old adult. 19-year-old adult. Which one? Remineralization. Tooth surface modification. Guys, tricky question. Read the question properly. Tricky question. Very tricky question. Be careful. It's a trap. This question is a trap, like ADC questions. Looks easy. It's not. It's really a trap. Yes, definitely we need B Bravo. We need, okay, Bidu math. What type of caries? The size, it's code. The size is code 2. What does it mean, code 2? We said 1, 2, incipient. What's the management or treatment of incipient? Remineralization. How do you remineralize? Like to strengthen the surface. How to strengthen the surface? By surface modification. Oh my God, what does it mean? Surface modification means strengthen the surface. How we can strengthen it? One thing of them is fluoride. So the word surface modification means you strengthen the surface. What does it mean? Do floss. Because when you floss, means you modify the surface, make it strong. Modify means you modify it from weak Too strong. I see now. Everyone be bravo. I know, guys. Sorry, guys. These are the questions you really need to learn. I know everyone, like everyone of you now maybe got shocked. Like, oh my God. I see even people even answer C and E. And people even answer D. I can show this on my screen. Only few champions only. They answered A. I tell you guys the names. The only champions answered A. Dr. Wimbo, Dr. Lev. But I know that's trick, guys. That's tricky. Dr. Samiha, Dr. Shiva, Dr. Natalie, Dr. Sibia, Dr. Saunders. But the rest, D, B, B, D, D, A. Again, Dr. Abijat, and then B, D, D. Again, guys, the right answer is yes, Dr. Jasmine. That's okay. That's okay. We learned this. The right answer is A alpha. Why? We said this before. When you have code 2 means tooth has initial caries, means surface is soft, means you need to strengthen it, you need to modify it, you need to modify the surface. To what? To make it strong. How you can make it strong? Brush nicely. Use mouth rinse if possible before you floss. Floss nicely. Use fluoride toothpaste. Drink enough water. Treat hyposalivation. Avoid acids. Avoid sweets. In this case, what's gonna happen? You modify to surface from soft to be strong. You know what, guys? We still have things to go through, but I believe that's enough for tonight. I'm very happy, guys, you're still here, every one of you. The time started, you didn't go, you didn't feel bored. Tomorrow will be the critical thinking session. Will be very, very interesting session. Most probably it will be on dental caries, to cover more about dental caries tomorrow. And after tomorrow, let's say tomorrow, guys, at 8 p.m. Sydney time, we'll start our session on the same link for today. Guys, how was the session, guys? How was the session, guys? Did you like it? Did you enjoy it? Do you want me, guys, do something else differently next time? Do we change something? Do you want me, guys? Yes, if you want me add something, if you want me remove something, do anything, guys, can make you can feel this is gonna be even more easier to you, please let me know, guys. Amazing, like always. I'm very happy to hear this. I feel back to life after the session. I'm very happy, Dr. Deepika, to hear this from you. I hate this Facebook now on my messenger, on my stuff. I hate it. Because actually it can be even much better than this. Let's say stop sharing for now. I think if you stop share, things will be better. Just to share with you other things. Yeah, I think it's happening because of Zoom. Zoom and Facebook not good enough together. Okay, let me check this. Imagine they gave me the comments only from only guys, they gave me only the comments 2 hours ago. I don't know what should I which settings I should do here. Let me refresh again. Before it was very good for more than 2 years. Please don't say 2 hours only. Be good for me. Be good to me then. Okay, guys, who's guys attended tomorrow's session, guys? Who's guys going to attend tomorrow's session? Guys, any one of you guys going to attend tomorrow's session, guys? Please, guys, don't miss any session because believe me, every session is equally important. Equally important. Service modification, learn this phrase, more complex. Yes, Dr. Lev, you're totally right. This phrase is mentioned on TG, and it's very important for ADC exam. Ah, got it now. No problem, Dr. Neshma. Thank you, Dr. Bido. Thank you, Dr. Somaya. Thank you, Dr. Ashfaq. Thank you. Thank you, Dr. Kiran. Thank you, Dr. TS. Thank you, Dr. Maya. Amazing. Good to learn something new. Thank you, Doctor. It's my pleasure, Dr. TS. Dr. Lev, Dr. Bido with you. It's never enough. Thank you very much, Dr. Lev. And you know how much I respect you. And I really appreciate it. Thank you very much, Dr. Lev. And you make the session very interesting, by the way. Thank you, Dr. B. Thank you, Dr. Shama. Thank you, Dr. Rainbow. Which one, Dr. Kedam, did you understand? The modification? Okay. The word modification, service modification means it's a product term. It's a broad. It has everything in it. Fluoride part, it's a part of it. It has fluoride. So fluoride only not enough. You need to have fluoride. So as if you are in the clinic and they ask you, is it only fluoride will be enough to manage this case? No. Fluoride is important, but we still need to have good brush and good floss and to check that saliva is good and all the stuff. Okay. Thank you, Dr. Sepia. Thank you, Dr. Habiba. If there was fissure sealant in the option, which will be with the correct one? Surface modification, Dr. Sony. Thank you, Dr. Wing. Sir, great lecture. You are great. Thank you very much, Dr. Tanvir. Dr. Bido, can we re-watch the lecture? I want to re-watch it again. Yes, Dr. Oshi. I can send it specially to you, Dr. Oshi. Thank you, Dr. Zohar. Thank you, Dr. Sayeda. Thank you, Dr. Bido. It was really nice reason. I really like it. Please share the slide with us. Slides, you will have the session. You will have the session. I will be sharing the recording, so you will have it with you, yes. Thank you, Dr. Mima. Thank you, Dr. Bido. Thank you, Dr. Sabika. Sabika very much. Dr. Sabika, I tried to call you. I will call you again, okay? Thank you, Dr. Pavlo. Thank you very much, Dr. Pavlo. Thank you, Dr. Karan. Thank you, Dr. Zoha. Learned a lot. I'm very happy for this. Awesome session. Thank you, Dr. Lev. Dr. Patel, thank you, Dr. Bido. Got a new perspective of thinking today. This is the way, believe me, Dr. Patel. If you keep the things in your mind, you will be easily passing the exam. With good luck, because I always say good luck. I see people that are very smart, and they may struggle once, but they will pass, but with good luck. It was so good, Doctor. I like it. Thank you, Dr. Jasmine. It's my pleasure. Dr. Leas. Thank you, Doctor. Amazing. Thank you, Dr. Leas. Thank you very much. That was great. I'm very happy, Dr. Nadia, to hear this from you. It was quite good. Thank you, Dr. Abhinav. I'm very happy. Thank you, Dr. Sumaya. Very good. Loved it. Thank you, Doctor. Thank you very much, Dr. Sumaya. Okay. Tomorrow, guys, very important. Please, guys, ensure tomorrow you will attend the session at the right time. 8 p.m. Sydney time. So we can even have more critical thinking when we do role plays with the candidates. Can I ask question? Definitely you can ask. More radiograph questions? Okay, can be X-ray later on. If you want, guys, we can do X-ray. That would be good, guys, to do X-ray as well. Dr. Joanna says, very integrated. I enjoy a lot. Thank you very much, Dr. Joanna. I really love to hear this from you. I love when you guys got the things right and you're happy with it. And I am tired. I'm tired too. We're all tired. I did critical thinking after I have read all separated. Now I know how to apply the theory. Thank you so much. Now it's easy. I'm very happy to hear this. I think it's time to rest. We all need rest now. You guys will attend tomorrow's session. I'm very happy. Count me in. I'm very happy. Will be tomorrow. Will we have any session Friday? Most probably it can be either Friday, Dr. Pavlo, or Saturday. Please follow the plan. We're gonna update you with the plan, daily plan on the Telegram, our private Telegram group. You will get everything there. Okay, tomorrow, Dr. Wembo, very good. Thank you very much, guys. Every session is important, very important. Dr. Dectroza, thank you, Doctor. I have question. How can I contact the team for the My Alpha app? Is not working till now. Okay, Dr. Dectroza, please talk to Dr. Leia. Most properly, okay, I tell you where about the issue can be. Number one, please ensure you use the same email address you gave it to the academy, because every time I tell the alpha team about it, they actually telling me it's an the candidates sometimes they use different emails, or they say they may use the right email, but maybe the app is got expired or something, cookies in it. So they say that's what you need to do, please, Dr. Doctor. One, ensure you use your email address, exactly the same email you give it to the alpha team. Two, please ensure you use different browser. Three, you can delete the app and reinstall it again. At any time, you can contact the academy. They will be helping you in this. Can even give you stuff. Dr. Joy, thank you always. Thank you, Dr. Joy. I'm very happy for you. Post modification is something new that I learned. Thank you. Thank you, Dr. Shelpa. No problem at all. You will find in TG, by the way. Me too, Alpha Genius. Same things with Dr. Amima, please. Dr. Amima, if you can do the same things, and also at any time you can contact the help team. They will be helping you. Dr. Dr. Amal, you are amazing, doctor. Thank you very much, Dr. Amal. You are amazing. It's you, it's not me. Thank you very much. Dr. Apijit, thank you, Dr. B. Thank you very much, Dr. Apijit. Guys, I'm taking guys all question at the end, okay? Hi, Doctor. It was such a great lecture. Got clarity on Icdas and ICCMS. Dr. B, do I have a doubt based on clinical picture? How to distinguish between hypomineralization and code 1 and code 2? Look, this is a long story. I need a separate lecture to differentiate between hypomineralization, hypoplasia, and code 1 and code 2. Okay, that will be like a big lecture from the beginning. I will explain all this in details. Because now I feel my heart beats very fast right now. Dr. Bido, can you, and this really read the long explanation. Dr. Bido, can you upload this? Yes, I will. Worth every minute of listening your lecture, Dr. Bido. Thank you very much, Dr. Abhijit. You're right, you guys, great guy. Thank you. You know what? My body's shaking right now. When I hear this guys from you, when I hear you happy, your happiness making me happy. Thank you, Doctor. Very special lecture. Please, we want to continue this lecture on the other time. Okay, Dr. Iman, I can do this. The goat of ADC. Thank you very much, Dr. Pala. You are amazing. Thank you, Dr. Pala. Can you share this recordings, please? Yes, it will be on our Google Drive, Dr. Muhammad. I was busy, no problem. It will be in our Google Drive, Dr. Muhammad. Okay, learned a lot and my perspective has been changed. Great session. Oh, what was your perspective before? Okay, not about me. Perspective about Icdas, not about me, okay? No problem, Dr. Michael. Thank you. So happy that you all enjoyed the session. Thank you, Doctor. We'll stay up on Facebook page. Yes, and on Telegram group as well. It was attention capture lecture. Thank you, Dr. Adam. Thank you, Dr. Joe, very much. Please upload the slides on Drive, please. Yes, it will be in Google Drive. Yes. Dr. Nicholson, thank you very much for your great way of teaching. Thank you very much, Dr. Nicholson. I'm very happy you are happy for this. I really appreciate that you attend the sessions. And believe me, things will be easy. Once you start with this way, follow the plans, I believe things will be perfect to you, Dr. Nicholson. Thank you very much for saying this. Thank you, Dr. Bidu. Please get some rest. Yes, Dr. Winnie, thank you for your concern. I believe now I need to grab my my dinner because Coles will be closed right now. Because normally I get my dinner from Coles if I don't order from Uber. Have a great night to everyone. I hope you guys sleep well. See you tomorrow night. Bye. Thank you for Dr. Jasmine. See you guys tomorrow at 8 p.m. Sydney time. Sorry guys if I missed any of your questions, guys. I'm doing my best. Now we are more than 2 hours, like 2 hours and 22 minutes. I'm very happy, guys, you enjoyed the session. I'm very happy teaching you. I'm very happy you listen to me. I'm very happy you are part of my life. See you guys tomorrow at 8 p.m. Sydney time. And we're going to have the critical thinking for dental caries. Thank you very much, you guys. It's going to apply more concepts. Thank you very much, you guys. See you then tomorrow. Thank you very much. Have a great night, guys, every one of you. Thank you very much.